Okay, welcome everyone. Just give it another minute as the numbers climb, as folks are let into the Zoom. Hopefully everyone's having a good Thursday morning. Okay, we're up to about 250. Numbers are still climbing. Give it another minute or so. Okay, getting up to about 300. I think we'll go ahead and get started. Good morning, everyone. Welcome to the town hall. Hopefully everyone's having a good week. Excited to share some great news with you today and pass the mic around to a number of folks with some cool topics. So we'll go to the agenda slide. Okay, so here's our agenda. I'm going to start out with an enriching lives story, most likely from our new Arise Hospital in the Phoenix area. Then we're going to have some new hospital and people to welcome, as well as a financial update during our business updates. And then after that, we're going to do a deeper dive into a couple of our strategic priorities. We've hit them kind of at a high level and want to pick two of them to go a bit deeper on. And then we will hand the mic over to the one and only Dr. Pat Welch. He's going to talk about clinical learning and development. And then we're going to hear from Shane Wilson on our Project Artemis. And so that's the modernizing of our finance, our HR, and our IT systems. And then lastly, we'll have some Q&A. And so Christy, I think we're going to skip over to our business updates. Yes, because Dr. Lozada has not yet joined, so we'll kick it over to Adam Koch. So he's our group leader for Group 11, and so he's going to give our first business update. Over to you, Adam.
Great. Thanks so much, Ryan. Really excited to talk about a new hospital that opened just over a week ago, a hospital that is 5 years in the making, and that is our new VESH West Springfield site. VESH West Springfield was originally conceived as a satellite location to our VESH Deerfield site, which is a beloved site within the Western Massachusetts community, and really sort of the only site within the Western Massachusetts community. And so we have had patients coming all the way from Connecticut, from New Hampshire, from all across New England to come there. It's a well-regarded, beloved site, and saw the need to open an additional site to serve the needs of our patients. It opened last week, 11,800 square feet. We opened with emergency, critical care, urgent care, surgery, and internal medicine, and obviously continue to build. And I will say, our vision kind of was proven true right out of the gate, filling an immediate and incredible need for the community. 29 patients right on the first day. I think that is a new record. We have a full slate of consults for our surgery team. IM, critical care, everything is growing. I just learned 10 minutes before this call that we're adding another day of internal medicine starting this coming Monday. So it's just been, a phenomenal start for the site. I will say, and I shouldn't, since Trey isn't on this call, I'll say it, that we hit our budgeted revenue for October within the first 8 days of opening. So from a financial standpoint, also, it's been just a tremendous win for us. Lots and lots of kudos go out. It does take a village. So Amanda and the marketing team playing a huge role in getting us where we need to be. We've opened with a full slate of doctor coverage, thanks to Suzanne, Betsy, Kristen, and the recruitment team, the IT team, the apps team, helping us to be able to handle that patient volume right on day one. Design and construction, who saw this thing through its very long journey, but really guided with a strong hand. So thank you to Emerson, Stacy, etc. And our new site openings team is always making it a fun and exciting start between Kevin, Suzanne, and others. And then, of course, the Vesh team, who all did incredible work. But I will shout out Mariah, Mel, Brianna, and Hannah from our Deerfield site who helped with this opening, managing two jobs at once, really. Dr. Johnson guiding us with a strong hand, and most of all, RHD extraordinaire, Kerry Gardent, who conceived this idea 5 years ago, saw it through everything, and simply just was the power driving force that took us to this incredible success. So we're super excited for what the future brings. It's very bright at Springfield, and it's been a tremendous win, not only for EVVH, but the entire community of Western Massachusetts. So hats off to so many people. And with that, I'm going to turn it over to Tyler Narveson to talk about another really exciting opening that we've had.
Great. Thanks, Adam. So yeah, super excited. Is my camera? You can see me there. Super excited to discuss Animal Urgent Care Northeast. So this hospital is actually the third hospital under the Animal Urgent Care umbrella, led by Kate Parker and Dr. Sarah Lovell. They serve a really important part of the community for affordable emergency and urgent care services, and have just seen tremendous growth over the last few years, starting with AUC Arvada, then adding AUC Park Hill, and then finally AUC Northeast here in the Brighton area. This 9,000 square foot facility is state of the art and serves an area that, in similar vein to Vesh, had a lot of need, and we're already seeing just great success off the bat. So they've had a ton of work here, opening two hospitals in very short order, but have done a phenomenal job, and couldn't be prouder of the hospital team. And just like Adam mentioned, it is a team effort, and a lot of the same folks who helped with Vesh did AUC Northeast as well, and juggled those multiple priorities. So thank you to all that were thought partners and worked through this, especially during COVID. A lot of this was done during COVID, and the challenges that faced with design, site selection, all of those things. So kudos to the AUC Northeast team and all of the support center counterparts that made this a success. All right. I also have the pleasure of announcing three changes in the West team. First, want to welcome Marta Kwiatek as the new group leader for Group 8. Marta joins us with significant experience in the strategy and operations areas. She has her MBA from Kellogg, and really is excited to join our company because she's actively engaged in animal welfare, education, and economic empowerment. You can see all of her pets there. And she's just super excited to come into our industry and hopefully be able to make a difference and help us improve patient care. She lives in the San Francisco Bay Area, and we'll continue to support Group 8 along with Paul Miranda as Dr. Dave Worth transitions to his DMO role in the East. Next, we have Justin Wang. I know it says welcome to Justin, but many of you already know Justin. He boomeranged back to us. So Justin is the new senior OSM for Group 18, which is largely the Phoenix and Greater Phoenix and New Mexico hospitals. Justin, his name sounds familiar. He previously partnered with us in FP&A for both Spec ER and equine, including helping build a lot of the fundamental reporting that a lot of you use today. Justin was excited in similar vein to Marta to move over to the operations side of veterinary medicine, as he's really enjoyed seeing that side of it, and couldn't be more excited for him to leave his mark with the team. And then lastly, another fun announcement. Congratulations to Jeremy Renshaw, promoted to group leader of Group 9. Jeremy was the senior OSM in Group 12 with the Legacy Stage group. You can kind of see his background there. He started as a hospital manager in the Dublin practice, was promoted to director of operations, and before that he had over a decade and a half of multi-site operations management experience. So Jeremy's going to stepping into the Pacific Northwest group leader role. Couldn't be more excited for him. He's already hit the ground running, and is really excited to be able to support those hospitals up there. So 3 great announcements in the West, and couldn't be more excited to work with all 3. All right, now I'll pass it on to Donna.
Great, thank you very much. So I get to follow it up with a 4th great announcement, and I have the distinct honor of filling in for Trey Neal today while he's away on PTO with his family. So I want to introduce those of you who don't know her to Judy Wagman. She's been with us for quite some time. We want to congratulate her as she is being promoted into the group leader role for Group 14. So just a few fun things about Judy. She lives in the Raleigh-Durham area, has 2 adorable beagles that you can see there, Jimmy and Miles. She has 2 grown children, enjoys competing in AKC obedience and rally trials. And it sounds like Jimmy's pretty far along, but Miles is coming up soon. Avid quilter and reader. I think Judy's career is really impressive. She's a certified veterinary technician. She worked with the Massachusetts SPCA Angel Network for nearly 30 years. She served as the Director of Clinical Nursing Services for NC State's College of Veterinary Medicine. She joined NVA in 2012 as a regional director, hospital director for general practice, and she moved over to specialty and emergency in 2019. She received NVA's first Servant Leadership Award, and anyone who knows Judy knows that she continues to demonstrate those characteristics every single day. So on behalf of Trey, who's not here today, and the rest of us, I want to congratulate Judy on her promotion. So now let's turn our attention to our 2023 revenue performance through September. Year-to-date revenue is exceeding prior year by 8.6%, but is lower than budget by 1.7%. Our year-over-year revenue grew by 5.6%, but it's down versus budget 6.7%. September was a pretty rough and surprising month across the board. The story here is our visits, which are down 4.3% year over year. And in September, our visits were 8.1% below budget. Across all hospitals, we had 16,000 less visits in September than August. September was an unusual month too, in that we had a holiday on the 4th, and then IVAC conference began, I believe, on the 7th. And we believe we had a greater than usual PTO usage. There was some reported COVID outbreaks following the conference. In addition, we know that there is the added distraction of back to school and the demands that that puts on individuals and families at this time of year. So I'd like to encourage each hospital leadership team to do a really thorough review of your contributing factors for your particular hospital for the month of September, and include your group leaders in that discussion. Ask these questions. Were there other contributing factors? Is your marketing strategy sufficient, or does that need to be refreshed or revisited? Could PTO be managed differently so that visits and ultimately access to care are not impacted to such a great degree? Was the revenue shortfall an isolated issue, or is it continuing into October for you? Because it does appear that after the first week of October, across the organization, the decline in visits is still an issue. And if there are revenue shortfalls that are beyond your control, what other steps do we need to take to control expenses, such as lay staff labor management in a proactive way, and holding off on other purchases just as you would at home if your income was less for a period of time? Many hospitals are using the prospective lay staff labor tool, and that can help project your revenue based on specific conditions of your hospitals and plan your lay staff labor accordingly, adjusting for conferences, PTO, and other fluctuations in volume of cases for other reasons. I would also suggest exploring any GMAP initiatives that you may not already be engaged in that might apply to your situation and take advantage of the additional support. So let's dig in a bit, and as leaders, do analysis and develop a plan of action to course correct, and look to your group leadership and group initiative leaders to help provide more support. We're in this together. With that, I'll turn it over to Ryan.
Okay, thanks, Donna. Just want to echo my congrats and welcoming AUC and VESH. Awesome start, both of those hospitals. Jeremy, Marta, Justin, Judy, welcome. Great to have you on the team. I think probably the most impressive thing I saw there actually was Marta's picture with 5 pets, all poised for the camera. So I've tried to do that myself for Christmas cards in the past, and I know that is no small feat. So congrats on that. So we're going to rewind and get it back to Dr. Lozada to talk about our Enriching Lives story. So over to you, Dr. Lozada. Okay, I think you're on mute. So if you, oh,
Can you
there
guys hear me okay now?
we got it. Thanks.
Perfect. Thank you guys. I'm Dr. Lozada. Sorry that I'm running a little late this morning, but I've got a great story to share with you guys that our team here was able to do wonders with. I know the owners were very happy, and here as a team, we were very happy. But just as a quick introduction, I'm one of the criticalists that works out of several that work here at Arise. But this is going to be a case about Loki. We can move to the next slide. So Loki was an 8-year-old male neutered Great Dane that presented initially to our hospital kind of late during a rush over the weekend, had some initial diagnostics, had been sent home on some antibiotics, and the owners called saying he wasn't doing well, had been vomiting, so he was instructed to be brought back. And unfortunately, when he actually presented to the ER team overnight, he was dead on arrival. So he had no auscultable pulse, was not breathing on his own, and our overnight team was instructed to start CPR. And so they did perform CPR for over about 8 minutes and were able to get a pulse back on him. And by then, our morning team was rolling in, and they did a great job of jumping in to help with this post-cardiac arrest patient. This is a picture of him included here after CPR. This is before he ended up going for his next diagnostics, but this was a picture probably an hour or so post him being resuscitated. So our team ended up trying to decide a couple of different questions. Definitely a lot goes on in a post-cardiac arrest patient. The biggest question we're always trying to answer in these cases is, what was the potential cause of arrest? And is there anything that we could potentially reverse to try to increase our chances of survival? So in Loki's case, he had received some abdominal x-rays. We had done bedside ultrasound, some point of care blood work, and he was found to have fluid in his belly, which we were able to sample and diagnose what we highly suspected as being a septic peritonitis. So an infection within the abdomen caused by free-floating bacteria. And in his case, what the source was suspected to be was a prostatic abscess. He'd had a very enlarged prostate, one on rectal exam, as well as on these radiographs that we were able to find. And so our suspicion had been that he had undergone an infection in his abdomen from a ruptured abscess, had continued to develop, and these kinds of cases can deteriorate quite quickly, which is what happened in his case. So even though he had just been resuscitated for post-cardiac arrest syndrome, our next goal was actually to try to get him as stabilized as possible for an emergency abdominal explore with our surgery department and our anesthesia department as well. So Loki did go through surgery, and he thankfully did quite well. There was a lot of input from our anesthesia in terms of trying to keep him as stable as possible. We're always monitoring every organ function as possible in these kinds of cases in a septic abdomen, but in particular for a post-cardiac arrest case as well. So he did end up going for an abdominal explore where they ended up kind of cleaning out all that infected fluid. They did what's called a prostatocommentalization, where they kind of patch up the abscessed area of the prostate. We took some samples and closed them up, and so it was a very quick surgery. Our surgeons here are really good in saying, quick surgery saves lives, and for Loki, that was definitely the case. We knew we needed to keep him under anesthesia for as little amount of time as possible. And then he was transferred back into our ICU, where we managed his, in particular, a lot of the different challenges that we can see in a septic patient. So glucose changes, blood pressure changes with their protein, and in particular for him as well, he was oxygen dependent post CPR as well. So as a quite a large dog, he did take a lot of nurses for his care and a lot of intensive nursing care while he was unresponsive still post surgery. And in his case, the family had a great question, which a lot of our clients will always ask. We can go through all of these intensive procedures and life-saving procedures, but what is going to be their total outcome? What's his quality of life going to be? Was Loki going to be Loki? And it definitely is a question that we have post-cardiac arrest when there isn't a lot of oxygen, a lot of blood flow going to the brain. And so initially we couldn't fully answer that family's question, but he ended up continuing post-surgery and anesthesia with continued monitoring of his neurologic status. Go on to the next slide. And thankfully, a couple of days later, this is Loki. He went from being a pretty minimally responsive Great Dane with a lot of intensive care support to a dog that was able to sit up and respond to his family when they came to visit him. He made a lot of impressive improvements, both cardiovascularly. So medically, we were looking at blood work changes, oxygen, organ changes, which he continued to show improvement. But the best of all was that it was hard to know or hard to even believe that he had been a dead dog just a couple of days before, as his mental status had been almost back to normal at this point. And a couple of days later, he was eating on his own with just very minimal feeding support through his feeding tube here. So this picture of Loki was probably about 3 days post his initial presentation of being dead on arrival. Our next slide here. And so in these kind of septic abdomen post-cardiac arrest cases, we're giving owners, sometimes a pretty realistic view of what we can do, but also what the possibilities are for success. And in his case, he was given a pretty guarded prognosis. For patients that present to the hospital already dead on arrival, a lot of clinicians, a lot of clinics will already assume that the chance of return is going to be quite low. Sometimes less than 8% is actually revived and then able to be sent home. In Loki's case, he stayed in hospital for less than a week. Not only did he beat the odds for a post-cardiac arrest syndrome case, he beat the odds for a septic abdomen case, and it was definitely not a one-person success. This was multiple teams that did their best since the moment that he came in and then transferred to the next service, and continuously gave the owners, that encouragement to hold on to some hope, as we had continued to hold on to hope since the moment he came in. So definitely a success story. And since he has left, we expect that he's going to continue to make a full recovery from his suspected septic peritonitis. And we are glad that he was able to go home to his family.
Wow. That's incredible. I'm kind of speechless about that story. When I think about our mission of inspiring hope through unparalleled care, I think you mentioned the word hope a couple times there. I mean, if that doesn't inspire hope and kind of give you goosebumps about what's possible in our hospitals, then check your pulse, because that was incredible. Thank you so much for sharing that story.
Thank you.
Really, really wonderful. Okay, good. All right. So now we're going to switch gears and talk a little bit about the work we've been doing over the past couple of months, really trying to get organized around our strategic plan for Ethos. And so we've already been through the vision, the mission, the purpose, and hit the strategies at a very high level. But today, just wanted to spend some time doing a bit of a deeper dive into 2 of the strategies. So you can go to the next slide. So this shows the 5 strategic objectives with a bit more detail on the value drivers that you can see on the right-hand side. And so we really see this as a virtuous circle. And so that the goal of leading in attracting and retaining our healthcare teams and advancing medicine, which is what you'll hear about today, are kind of the first 2. And then growing, which is establishing ourselves as partner of choice, and then leveraging scale, and then finally investing, and that's investing in our hospitals, our hospital ecosystem, really expanding the reach of our patient care. And so with that brief introduction, I'll turn it over to Brandon, who's going to do the deep dive into our first strategy. So Take it away, Brandon. Thank you.
Thanks, Brian. And I'm really thrilled to share more information on this first priority with all of you, especially because it's all about our people. We aspire to be the #1 employer of choice for veterinary healthcare professionals. And of course, if we win there, we know we'll also be getting the most inspired, highest caliber support center team members as well. Similar to Ryan's slide, we have another circle here. And we view this as a virtuous circle where each piece is dependent on the one before it. So the better we get at each step, the more it feeds itself. And as a circle, it doesn't have a beginning, but I'll start with medical leadership. So we have and will continue to invest in our medicine. And this includes areas like advanced medical equipment, discovery and science consultancy, creating career paths for our doctors and technicians that extend beyond the walls of our hospitals, and programs like adverse event reporting and peer review. In the future, we also plan to have better medical data so we can improve decision-making and outcomes, and all of this will help us lead in medicine. This in turn will help our talent acquisition team hire outstanding talent across our hospitals as we can showcase the resources and the opportunities that are available to our healthcare team members. We'll also provide above industry average compensation enabled by providing a premium experience to our patients, customers, and to our referring DVMs. For our existing teams and the new team members we bring on board, we'll be providing world-class development and help provide platforms for our doctors and technicians to showcase their contributions to veterinary medicine. And of course, this will improve the quality of medicine that we can deliver as well. That in turn will help us retain our talent, which will reinforce with great leadership and support, local ownership opportunities, and differentiated compensation. And all this feeds back in again to medical leadership. And keeps that flywheel spinning in that virtuous circle. So we have a strong talent acquisition team that supports hiring technicians, hospital and support center, leaders and doctors, including house officers. Just a few stats to share with all of you. We've got over 15,000 boarded specialists and ER doctors in our Avature database. And each year we screen and present over 1,000 of those candidates to our hospital teams. And we've got a goal to hire over 1,700 doctors over the next 5 years. On the house officer side, we've got over 200 interns and residents at Ethos right now, with plans for significant growth. And I also want to highlight that this is a team activity. We've got folks like Dr. Gareth Buckley working to increase the support for our house officer program. Hospital leadership is engaged in creating a compelling candidate experience, and getting candidate referrals from our current doctors and team members all provide a critical part of building the best healthcare team for Ethos. And for anyone that leaves Ethos, we also don't want that connection to end. So we've been pressure testing for a while the idea of an alumni program, and have started to build out the next steps for what that will look like. So that's an exciting development that should be coming in the next several months. And once we get them in the door, we have great resources to mentor and develop our veterinary healthcare team members as well. Dr. Pat Welch is going to talk more about his vision for these services, including Vet Bloom, a little bit later in today's town hall. But all of these services, including Vet Bloom, are critical building blocks of our strategy here. And I'd also like to highlight that we're continuing to invest in community programs as well, including retreats like Health of Healers and Women Empowering Women, as well as hospital culture team building programs. So with that, I'm going to pass things off to Dr. Stacy Burdick.
Thank you, Brandon. Hi, everybody. So today I'm going to be talking about our strategic pillar of advancing medicine, which is obviously something I am very excited and passionate about. So as we thought about what we'd like to do over the next several years with medicine and thought about integrating our teams from our Legacy Ethos family and Legacy Sage family and within NVACF, we really thought about our areas of focus that I have talked to you about previously, being sustainability of the profession, providing excellent professional development opportunities, and really excelling in medicine, and not only saying that we practice best medicine, but really proving it out. So as we thought about where we've come from and where we'd like to go, we thought it was incredibly important that we still utilized the opinions and ideas and feedback from the teams that we have today, as far as MDAC and our Specialty Advisory Board. Our Medical Directors Advancement Council was the group that really helped to form the vision for the Specialty Advisory Board. And over the years, both of these groups have really helped to define where we'd like to go in the future, as far as what resources we'd like to provide to all of our hospitals and all of our veterinary healthcare teams as a whole. And so these two groups are near and dear to our heart and extremely important in helping us to continue our direction going forward, to make sure that we're on the right path and delivering the resources that each of our hospitals need. So with that being said, these groups and their ideas really help to form the foundation of our team going forward. And I'm really excited by our team. You will be hearing from Pat Welch shortly after this, talking about clinical learning and development as our new VP of clinical learning and development, as well as remaining in his role as the CEO of VetBloom. We also have a new director of nursing that I am very excited to announce. Her name is Christina Giovanelli, and she comes to us with a lot of industry experience, and similar to Justin, is a boomerang coming back to us after a few year detour with Veg. She will now be joining us again, which I am extremely excited about, and you will be hearing from her shortly. We also have a VP of Medical Operations, who is Dr. Lauren Boyd, helping to partner with our hospitals and our hospital leadership teams to really bring that medical thought partnership as we continue to talk about the business and learn about the business. We also have a Director of Medical Excellence. So that is Dr. Kristen Frank. I think I'm being rushed here, but I will go faster, I promise. But that is Dr. Kristen Frank. And Dr. Frank, again, will be really focusing on proving out that we're practicing best medicine through metrics. And as Ryan discussed earlier, that includes our patient safety reporting system, our peer review processes, really implementing medical KPIs so our hospital teams can see where they sit, and an antibiotic stewardship program, just to name a few. Kristen has a very long list of priorities she'd like to accomplish in the next year. And then leading with science. So making sure that we're practicing evidence-based medicine is incredibly important to us. And we have an awesome leader in Dr. Sam Stewart leading the Veterinary Science Consultancy, which is the group that partners with our external vendors to bring science and innovation to our hospitals and really take the burden of administration of clinical trials off of the hospital teams. Sam really helps to do that. And we are expanding our partnership with Ethos Discovery coming soon, which I am incredibly excited about. Ethos Discovery is the group that really helps to create novel research and innovation based on the hospital needs. So unmet needs within the hospitals from our doctors. Ethos Discovery will then go create trials around and try to fill those needs, which is really, really exciting. So with that, I will hand it over to Dr. Pat Welch to dive deeper into our clinical learning and development department.
Awesome. Thanks, Stacy. It's great to be here with everyone. So as Stacy mentioned, so I'm a veterinary ophthalmologist by training, but I've always been drawn to learning, growth, and technology. So that's where I've really spent the majority of my 15 years with Ethos. I think for those that haven't met me before, just a little bit of quick info. My wife, Chris, 15-year-old daughter, Darcy, and I live in Ipswich, Massachusetts, so just a little bit north of Boston. As you can see, we have quite the menagerie at home. We have 2 golden retrievers, a bearded dragon, which in full disclosure, I wasn't fully supportive of, but I've grown to appreciate him. And then a 200-gallon saltwater reef tank. So plenty of stuff to keep everyone busy. Outside of work, I'm a big hockey fan, Boston Bruins fan. Love to brew beer, although I haven't done that as often as I would like over the past year. And then lastly, as a family, we love to travel. We actually just hit 52 countries visited so far. So we're aiming for 100, and I'm just starting to do the math and realizing I need to pick up the pace there. But that's just a little bit about me. So really excited to sort of jump into the clinical L&D stuff. I think I wanted to start out with just a high-level overview of clinical learning and development as a functional area, and talk about its alignment with the priorities of the medical function that Stacy mentioned. So really, namely medical excellence, sustainability of the profession, and professional development. And really, this slide sort of sums up our three overarching goals. So you can see over on the left, the first is engaging, growing, and retaining teams through learning. We're really working hard to build really robust virtual, on-demand, but also hands-on experiential offerings for the teams. We all know that career growth opportunities and engagement through learning, those are really key drivers of engagement for team members. So we're focused on career pathing, content that enables skill development, and then role transition, whether that means pursuing credentials like a VTS, or moving from assistant to technician, or gaining leadership abilities to look at sort of management opportunities. Our programs are really designed to empower team members to advance their careers within Ethos. Second up is growing talent internally. So we know talent's in short supply. We all feel that. So we're really focused on development programs that create careers for our team. So we've got a NAFTA-approved veterinary assistant program, and that's designed to bring people in from outside of animal health and bring them into the industry. We're finalizing a CSR curriculum, which is exciting, that we'll be releasing in 2024. Obviously, technician credentialing, our house officer programs under Dr. Buckley. I think when you look at the total sort of portfolio of offerings, I'm really proud that I don't think any other organization has the robust opportunities for internal development that Ethos does. And I think third, shifting to competency-based learning. So rather than having a bunch of isolated continuing education opportunities, we're trying to build curricula in core domains like anesthesia. These competency frameworks allow us to align learning outcomes with the needs of the hospitals. We can track team member growth, and ultimately really demonstrate an ROI on learning and tie it back to skills and performance. And that's just incredibly important to continue to grow and develop our programs. So these pillars support the mission, which is to drive measurable business and patient outcomes through learning. And then we can look at some really short-term objectives here through the rest of 23 into 24. The first is communicating this new structure, hospital by hospital, to share this vision, and also listening to understand hospital needs and make sure that we're aligned here. So we've previously shared the clinical L&D organizational structure. So Gareth Buckley, Tracy Hightower, and I are really working to ensure that we're creating the right connections for the clinical L&D team with the broader organization. I think second is rolling out VetBloom as a foundational learning platform for the entire organization to make sure that every Ethos team member is in sort of a common space for learning. So we're excited about doing that. And then lastly, continuing the implementation of the competency-based veterinary technician education framework, or the CBVTE, and that work's been started. So we can jump to the next slide. I think here we just see a lot of initiatives that are aligned with the medical goals of excellence, sustainability, and development. So there's a lot here. The goal is not to run through everything now, but to share it, allow everyone to take some time to review it, digest it, and then hopefully follow up with comments and questions. I'll highlight a few key points just to really focus on what we've been doing to advance education, really through innovation. So first, our ERI and CBVTE frameworks. I mean, those are industry first that we've created collectively, we've shared across the profession. That includes publication in a peer-reviewed journal for the ER framework, and meeting with groups like the American Association of Veterinary Medical Colleges to share our tech competency framework as the first tech competency framework in the profession. I think second, our online VA program. It's the only NAFTA approved VA program from a private veterinary group. So that's amazing. It demonstrates our ability to deliver these rigorous quality training programs and sort of embrace Ethos real world clinical expertise to bring them to life. Third is just solving problems that are in the profession that we recognize. So we recognize the need for, I think, a higher level of business and management training in the profession. And so, we went to Purdue to create a collaborative veterinary mini MBA, which launched this year to sort of address those unmet needs. So really excited to have the first cohort of students going through that. I think in 2024 and beyond, we'll just continue to innovate. We're looking to create new competency frameworks for additional roles. We're looking to work with Gareth to reimagine house officer programs, and even working to create an industry first, which is basically a credential for those in our practices who are involved in teaching, to try to create some new standards around teaching in the organization. So, all these things, it's not just transforming learning at Ethos, but really trying to make an impact on the profession. So next slide. So we've talked a lot about VetBloom, and I know everyone has had various sort of amounts of exposure to the concept of VetBloom. So for the last few minutes, I just want to share a quick overview of what the heck VetBloom really is. So VetBloom is a learning platform and content library that comes together to sort of create what I like to think of as a digital learning ecosystem. We've got about 600 learning modules in the library. Just under 200 of those are RACE approved. We've also got formal programs. So that's where you'll access our VA program and the CSR program. That's where right now we're building out all the ERI offerings and ERGO. And so we've got all sort of the on-demand asynchronous content, but we also have the ability to integrate live and virtual learning sessions as well as sign-offs and checklists. So really create sort of blended experiences, which is huge. We've had several legacy MVA Compassion First hospitals as part of the VetBloom ecosystem as far back as 2019. We currently have about 60 Ethos hospitals on the platform. So we're excited to be able to roll out the newest, latest version of the platform to the entire Ethos portfolio of hospitals. And then we'll finally have one centralized place for learning where everyone can come together. I think the other benefit of VetBloom is the creation of connections within the profession. And so if we look at the next slide, that's really some of the power that we're talking about, this ecosystem concept. So VetBloom has about 75,000 learners from across hundreds of organizations. So you see a lot of practice groups there, a lot of academic groups, associations, vendor partners. For example, Long Island University delivers anesthesia training from VetBloom to its veterinary students. Appalachian State uses VetBloom for their tech program. Just a ton of examples like that. So this creates this networked ecosystem where every individual or organization can consume content, but they can also create content. And it just creates a conduit for seamless sharing of learning across the profession. And then next, if we zoom out a little bit and look at this network, it's like you've got this network of individual nodes, but they're all interconnected. So each organization has a private site, yet they're able to access shared learning. And some of the examples, even recently, our partnership with IDEX and their tenancy on VetBloom led to the creation of Springboard, which is a really new novel site delivering basic science training to veterinary residents across the globe. Navas, VetBloom helps the North American Veterinary Anesthesia Society manage their annual symposium. And because of that, we get access to all the on-demand content from that, and we can make that available to all of our learners, regardless of which organization they're with. So, soon, as you can see over in the left-hand corner, Ethos will have sort of their own sites at each hospital, again, all interconnected together. So lastly, I'd like to thank everyone for their time. I really am proud of what we're trying to create here. we're trying to revolutionize learning for Ethos, but also the broader veterinary profession. We're adding value to our industry and our profession, which is really meaningful. If anyone would like to chat about L&D, certainly reach out. Love to connect at any time with anyone about any learning topic, because I think our whole team's really passionate about it. So thanks very much, and I think I'm handing it off to Shane now.
All right, wonderful. Thank you very much, Dr. Welsh, and good morning to everybody on the call. I think I'm a new face to many. So my name is Shane Prosh Wilson, and I lead our system transformation efforts across the support functions for both Ethos and GP. I reside in Dallas, Texas, and pictured below is our beautiful 11-year-old hound shepherd mix. His name is Dudley, and I think he's pictured here being sort of what I might call patiently displeased with our 2-year-old who, insists on sharing his bed. So role-wise, I have the fortunate opportunity of working alongside Ethos technology, finance, HR, field ops, sites to drive the modernization of our systems. And this is a project we've sort of aptly named Project Artemis, after the Greek goddess and protector of animals. And this is a name you'll likely see a lot more in the coming months as these tools roll out. So before we dive into what we're doing, it's really important that we distill our why very well and articulate why it is that we need to improve, because there's a lot you could do, in a program like this. So we've conducted extensive site study. We continue to evolve these objectives to really get at the major pain points of hospital management and leadership when trying to scope out this work, what we're going to do and how we're going to design our tools. So we've really distilled it into 3 main North Stars that we're living by. The first is our systems and processes just need to be faster. There's too much time wasted doing low value work like manual data entry. The second is our systems need to be more reliable. So too often we find ourselves in situations where we can't be sure if information is current or complete, and we want to remedy that. And the last is we want our tools to be connected, both to one another through integrations and connections, as well as to our teams through access, not being able to, not being lost as to where a tool is and finding things easily. So all of these 3 North Stars have influenced how we have scoped this project. And what I'll walk through next is Project Artemis's kind of 5 major enhancements that'll be coming to Ethos hospitals this year and next. Okay, so what to expect in this year, in 2023. So you all, or many of you, will likely be familiar with this first one. So GoFetch, really what we need first in a program like this is 2 things. We need a place to go to find information and tools, a single place, and that same place to find everyone that can help us. So this was really the focus of this first deployment, GoFetch, our intranet site, and Retriever, powered by ServiceNow, your one-stop shop for information and help from support functions. So GoFetch, I mean, it's an intranet. It can work just like Google. You can use the search bar to search what you came for. You can navigate around to find information and tools. And on the right-hand side, if you're looking for help from accounts payable, payroll, HR, technology, or several other areas, you can click the Retriever button on the right-hand side to submit a service request. So this will ensure that your service request reaches the right person the first time around, and will replace some of the legacy ways, email distribution lists and things that have been less efficient to run. If you haven't visited, or you haven't visited in a while, please go to gofetchinfo.com. It's always ever improving. So second thing in 2023, and many on this call will be familiar with this, is we're migrating all of our email and our credentialing over to Microsoft 365. This is important because information security is important, and pulling all of our emails onto a single Microsoft instance will make us more secure, right? That is extremely important. But why is this exciting? This is the foundation that will allow us to have a single sign-on for our tooling. And over time, we will build towards an environment where we have more and more tools with a single set of credentials. So eliminating the need to save 15 passwords and browser favorites and all of that good stuff. So coupled with GoFetch as the storefront, We want these two together to be your ability to know where to go and how to get through the door to find everything that all the tools and information that you'll need. Moving to 2024, apologies. So what's coming next year? And many of you are already familiar with number 3, as a lot of the pre-work is happening to deploy this at the very end of 2023, beginning of 2024. But we are replacing our HR and payroll systems with Ceridian Dayforce, which is an industry-leading HR, scheduling, time attendance, and payroll tool. There are many on the call that are super familiar with this because Ceridian Dayforce is actually used in just under half of our hospitals today. And so we will be migrating to a single instance of Ceridian Dayforce with common functionality and information sharing. What is this going to do? It's going to allow us to have a single HR database, better time tracking and connected to payroll, minimizing manual payroll work across Ethos hospitals, and driving to overall improvements about how we build and deploy the right schedules. So thank you in advance for everybody that has worked towards the end of your deployment in December here. More to come as we deploy at the end of 2023, and then second wave in April of 2024. The fourth improvement will be a new expense management system. So we'll be deploying Oracle iExpense, which is a mobile-first tool that will allow us to easily track corporate credit card expenses, snap photos of receipts that will attach to expenses automatically, drastically reducing the amount of time it takes to manage credit card and day-to-day expenses. This will be deployed in April, May of 2024. And lastly, our procurement systems. So this will entail enhancements to VetCove, which we all love for a lot of our direct procurement, and the introduction of Oracle iProcure to consolidate across US and Canada to consolidate where it is that we find purchase orders and invoices, and really try to take a lot of the accounts payable work that we do today off of the site. So this is the kind of the first step to drastically reducing and eventually eliminating the need for manual invoice entering and coding, and a really, really important piece of the puzzle when we think about our overall finance systems. So more to come here. We've been testing this solution along Ethos site leadership, and we're planning on deploying this as well in April, May of 2024. And last, I just want to a shout out, a lot of gratitude and humility to the Ethos teams that have been contributing to the progress of this. This is by no means an exhaustive list of thank yous. There's more names that I can put on a page here, but our field change committee has really tapped in to help us design tools, provide us a lot of foundational knowledge about Ethos communication channels to allow us to design our program correctly. Not on the page, I think, is Vesh Wichita and Michelle Rader, who piloted our Dayforce tool back in June. Our Change Champion Network has been leading communications and helping us to drive to effective change management within Ethos. There's been Oracle prototype testing, so more than I can say thank you to, but we're incredibly appreciative of all of the involvement here, and your input is very critical to the success of a program like this. So thanks, and I will hand it back to Ryan.
Great, thanks a lot, Shane, and thanks to all the names that were on that slide. I mean, truly a Herculean effort to get all of these things in place, and really excited to have our systems fully upgraded in the months to come. So thank you. We've got a few minutes left for Q&A. Before we jump into it, just want to mention that there was a few questions about changes to benefits, and our HR ops and the benefits team are going to host a overview with the hospital leaders before open enrollment, which is going to be November 1st through the 15th. And so then following those meetings, they'll host virtual meetings with team members, and then mail the open enrollment materials to each hospital. If you have any specific questions after reviewing the benefits material, please email. It's benefits@nva.com. So feel free to email them anything. And so with that, I'll turn over to you, Christy, to see what we have on the questions list.
Yeah, we received a few pre-submitted questions. The first is, Do we have any decisions regarding the location of our second headquarters?
Yeah, so I'm guessing the question is around Austin. The announcement that we made last month, or actually a month and a half ago now it is. And we're still looking at locations. We actually had a meeting last week in a temporary location, and so we're still looking for both short-term and long-term home there. But as soon as we have those details worked out, we'll let you know.
Great. The next one is, what are some of the biggest challenges that are more time consuming than what was planned?
Yeah, so this is a tough one. You know, I think with changes as large as we're going through here, splitting two companies, I mean, there's always, you know, things that take longer than expected. I guess something that has taken a while, we have some lingering things to work through, is just the fact that you can't snap your fingers and instantaneously split two large businesses apart. You've got a lot of folks that are doing crossover work between New Ethos and NVAGP, as well as the holding company and equine and pet resorts as well. And so I think just kind of untangling some of those things and the work that those individuals are doing. You know, in the back of my mind, I was hoping it would be kind of in the blink of an eye, which was obviously wishful thinking, but that's certainly something that is a challenge that we're working through. And I think that GP team has been awesome partners. As well as the holdco or the steering committee that kind of sits over both businesses, and we've been able to work through that stuff one issue at a time. And so that's certainly some lingering challenges that we're working through.
Great. Once we go public, will there be a chance to award or offer options at a low price for employees?
Yeah, so short answer is TBD. So there are some pretty strict rules around who can invest ahead of an IPO, and you can't really have broad access. But we're definitely in favor of stock ownership by everyone in the company, and we're working we will be working on a program and certainly looking across industries for best practices there.
Okay. And what are the steps Ethos is taking to recruit and retain ER doctors?
Yeah, so lots of things. I'd like to hit on an event that we had earlier this week. So there was a mentorship retreat held in Kansas City, and that was led by Dr. Booth, Dr. Annie Wayne, as well as Dr. Gareth Buckley. And that was really to gather all the folks that are doing the ER immerse, as well as some of the house officers. And it was an incredible step forward, honestly. I mean, we're pulling together three wonderful programs: the Spec ER mentorship program, the Legacy and Compassion First Catalyst program, as well as the Ethos EVET program, and gathering all those mentors together to really share best practices, build relationships, talk about what is the best way to train and teach. Is going to make that program so much stronger. And I think that the work that was done this week was pretty foundational, and I think is going to help us from a recruiting standpoint. I think it's going to make the program stronger from a retention standpoint, ultimately strengthening our hospitals in the ER front. Couldn't agree more. I mean, this is a super important segment. It's really difficult. It's a tough job, high stress, and recruiting and retention is a top priority for us.
Can I just add to that, Ryan? I think that was really, really well done, and agree wholeheartedly. I would just add that in addition to training new graduates with the EVET and ER Immerse programs, we're also focusing on advanced career training. So those doctors, those ER veterinarians who have been in practice a while and maybe just want to advance their knowledge and work on some new credentials, we are offering a significant amount of support and putting a lot of effort into ABVP, the ABVP credentials, specifically with the ER fellowship afterwards. So I think that that's very unique for us, in that we have the optionality for creating long-standing and careers in emergency medicine and that sustainability, because that's a big issue with emergency. People get burned out and leave very early. So trying to make sure that we have full career satisfaction with emergency doctors.
Absolutely. Thank you, Stacy. Appreciate that.
Mm-hmm.
And we are at time.
Okay. All right. Well, thanks everyone. Sorry we kind of had to rush through the very end there. Please send us an email if you have additional questions. Happy to try to get those answered, as well as the next town hall. We'll want to make sure everybody gets their questions in ahead of time, and we can probably try to scale back a little bit on the content because we did go a little bit long this time. But hopefully everybody has a great rest of your day, rest of your week. Thanks for being with us, and take care.